if you could state your name for the record and begin your testimony.
Yeah, my name is Jason Roman. Thank you, Madam Chair and the committee, for opportunity to testify on this important topic. I'm a licensed professional clinical counselor and licensed alcohol and drug counselor. I run a small clinic here in the Southwest Metro. We specialize in co-occurring disorders, which is just basically helping people manage the combination of mental health disorders and substance use disorders. I'm here because, as Senator Mann just mentioned, there's a Minnesota workforce shortage. I'm trying to hire clinicians right now to expand access, but insurers have prevented me from doing exactly what we're saying we need more of here. Not every clinician is trained to help clients with co-occurring disorders, which is why clinics like mine have historically been able to kind of petition and try to get contracts, but that's not happening now. They're simply just saying, due to network saturation, we're not taking more, we're not offering more contracts. So the Minnesota's 2024 Behavioral Health System Review showed our mental health and substance use workforce was already severely strained, and that was with the Any Willing Providers Act still in place. So if we were strained then, blocking this just continues to add to that strain of being able to add more counselors to the field. My clinic's ready to hire, like I mentioned. We have clinicians who want to join us, but every time I have a conversation with a potential clinician, I have to let them know that I don't have a health partners contract, which makes it really challenging for me to hire someone if they can't, their clients can't come along with them to my clinic to be cared for. The denial is not based on quality of care or safety issues or anything like that. It's simply based on insurance companies saying that they're full and that they have enough people. Before the statute expired, like I mentioned, if you had a specialized population, you could at least make the case that a contract was needed. I personally, thanks to Flourish Business Solutions, who's here today, I personally got some inside communication with a member at Health Partners who was supposedly a decision maker, and that person just simply repeated back every time, our network is full. They weren't interested in hearing about the need in our community. So instead of adding clinicians and to the workforce and reducing wait times, I'm telling clinicians they can't work for me because the network is full. There's a workforce shortage. This is an access problem. This is just, it's a bottleneck created by policy, essentially. I've been talking a lot about my clinic, but essentially it's really about the clients, and they feel this when they can't follow their therapist to a clinic. When they become independently licensed, they can't get a contract, they can't follow their therapist. You heard some testimony earlier about substance use disorders and how dangerous it can be for clients when they can't get the care that they need, especially from specialized providers. So basically, local clinics like mine provide stable community-based care, but when networks close, the clients get pushed toward those large national platforms, simply because those platforms hold the contracts. This weakens local access and continuity. So I just want to finish by saying continuity of care should not depend on whether an insurer decides they have enough providers. This statute ensures Minnesotans can keep their therapists and that clinics like mine can keep building the workforce our state needs. Thank you for your time.
Thank you very much. And now, Mr. Kerr, if you could state your name for the record and begin your testimony.
Good morning. Thank you, Madam Chair and committee members.